everyone to today's webinar and to the kickoff of Arthritis and Lupus Awareness Month. I'm Kelli Matthews. I'm the chair of the Arthritis National Research Foundation Board, and I'm honored to be your moderator today, along with a fantastic group of panelists. Big thanks to each of you for being here. Appreciate it. And also to our sponsor, Jonsson & Jonsson Innovative Medicine, for supporting today's discussion. I'm going to frame up the conversation today a little bit, and then I'll introduce your panelists. This is an important conversation, and especially important to include for the kickoff of this important awareness month. Nearly 1 in 5 U.S. adults, or about 21%, live with arthritis or related autoimmune diseases. Diagnosis often starts with symptoms like pain, joint pain, or swelling, but many people experience invisible symptoms that are equally life-altering. These include fatigue or brain fog, depression, anxiety, symptoms that don't always come up during a typical appointment and aren't always easily measured. These hidden symptoms can be very frustrating. They're misunderstood or overlooked, and that's really what we're here to address today. Our goal is to bring these symptoms into the spotlight and to understand how they affect patients and how providers can better listen for and respond to them. We get to hear from both patient advocates and physicians and hope that you leave today's conversation with new insights and practical communication strategies. So as a reminder, you can use the Q&A box to submit your questions, and we'll have Q&A towards the end of today's session. So quick introduction from the medical side today, we're joined by Dr. Anna Jonsson, who's an assistant professor of medicine rheumatology at the University of Colorado, Anschutz Medical Campus, and a former ANRF scholar. And Dr. Robert Corty, who's a current ANRF scholar and a fellow in adult rheumatology and immunology at Vanderbilt University Medical Center. And from our patient perspective, we have Eileen Davidson, who's an advocate known as Chronic Eileen, a writer, speaker, and RA patient living with autoimmune disease, and Miranda, a patient partner living with psoriatic arthritis, who will share her perspective and her journey. So we're going to start with Eileen and Miranda. And again, if you have questions as we go, just drop them in the Q&A. So we'll start with a little bit about, can you describe when you first started noticing these hidden symptoms and how did they change your day-to-day life?
I'll jump in first. So I was about 23 years old when I started to notice mostly pain in my hands and my wrists, and that proceeded for a little bit of time, but I was mostly just brushed off to having carpal tunnel syndrome because I was working as an esthetician, so I was using my hands a lot. And I also started to notice things like I would forget steps easily or I'd get tired pretty easy. But then when I had my son, I was about 26, 27 years old, my pregnancy was rather difficult. I ended up with a lot of swelling and issues, and I didn't know what was wrong then. And I assumed that all those uncomfortable feelings that I experienced in pregnancy would go away after my hormones settled. However, they did not. They actually got worse. So I was all the time feeling like I had the flu. I felt nauseous, dizzy. I had really horrible sleep. It was fragmented, waking up every few hours, or I would be going to bed way too early and waking up way too early. I was very forgetful. I would sometimes slur my words, even though I didn't have a drink. I wasn't drunk. It was just an undiagnosed autoimmune disease. I was very forgetful, and I was just so tired. And I expected a lot of this because I had a child. But by the time he was 2 years old, I knew that there was something really wrong, especially since I couldn't do my job anymore. So all these symptoms that I was experiencing, I decided to bring up to my physician and ask her to test me for rheumatoid arthritis due to a family connection with it.
Great. Thanks for sharing that. Miranda?
Yeah, I'm happy to jump in. I have a somewhat similar story, although there are some differences, of course. I started experiencing symptoms when I was about 26, and it also started mostly with joint pain, but it was very difficult to track because it wandered right between different joints, and it was very unpredictable. It would be really bad one day, not as bad the next. So it was really difficult to kind of say, these are my exact symptoms. And I think because of that, it took me about 10 years to get diagnosed. And I went in and out of having really, really difficult flares where I needed help even getting up, getting dressed. I couldn't walk. And then when I was pregnant, my symptoms actually went away. And that happens sometimes in pregnancy when you have an autoimmune disease. So we kind of stopped working on getting diagnosed for a while because I was feeling better. But then, of course, eventually my flares returned. And I too was very, very tired, but I had young children and I was working two jobs. So I felt like, oh, there's a great explanation for that. So it's interesting. When did I first notice, I think, the extreme fatigue as a symptom? I would almost say not until I had successful treatment because I just assumed it was my life. And then once I actually was successfully treated, I had so much more energy. And I think that was the moment where I realized that the fatigue was actually present as a symptom. And I think that's true for a lot of these hidden symptoms. For me, they onset slowly, right? Over about the course of a year was when it got really severe. So that makes it really difficult to notice them when they first onset.
Yeah, that's good to know and to keep track of. It's the what's the saying about boiling a frog? Is that
Yeah,
yeah.
exactly.
What's been the hardest part of dealing with symptoms that other people can't see? I'm gonna go in reverse. Miranda, what do you think?
Sure. Oh, uh, this is a meaty question for me. I think the assumption, right, that you're the same, that your life is the same, that your capacity and experiences are the same, right? There's no visual cue for others. Um, and I think that then for me was hard because it kind of places the onus of responsibility on you to explain what's happening to other people. And for me, especially at work, that wasn't something that I didn't want to just share that with people widely. And so I don't know, it just kind of felt like this secret struggle in many ways that was very unpredictable. And I think on top of that, if people aren't aware of what's going on, I think it can be difficult that one day your capacity is up here and the next day it's down here. Um, and it's just kind of a constant moving target. So I think for me, that was just the hardest that's been and continues to be, right? When I have a hard day or a hard few days, the most difficult part of having an invisible, right, disability.
Eileen, what would you add?
I would completely agree with everything that Miranda said, but I would adding like a little bit of how it affects our social lives,
Mhm.
especially as a single mom when it comes up into dating, talking about having an invisible illness. It's a little bit of a nightmare. It's can be frustrating, you look perfectly fine and then you just tell somebody something's wrong with you, especially with dating apps. It's like instantly gone. That match is no longer there. However, it is a blessing because it does take, the wrong ones out first and easy. So yeah, just the way that I think it affects the social life. And then having to explain over and over and knowing that they're really not going to understand unless they are diagnosed with something similar themselves.
Sure, yeah. Um, Eileen, have you ever felt dismissed or misunderstood in a medical setting? And what has helped change that experience?
Absolutely. I'm going to tell you a small little story. When I went into my family physician's office to ask for that rheumatoid arthritis test, I remember her saying, and finally looking at my hands. This was the first time after 5 years of complaining about hand pain that somebody actually took my hands and looked at them. And that's after years of complaining about it. So I asked her for the rheumatoid arthritis test, and she looks at my hand. She goes, I don't think it's RA. I feel like you're a bit young for that, and I don't see any visible swelling, maybe fibromyalgia. And at that point, I felt very dismissed, even though a few weeks later, when I did get to see a rheumatologist and my blood work was done, I was diagnosed with rheumatoid arthritis. And that was a huge lesson to me because that was, I think, the first point where I realized I really needed to advocate for myself in a medical setting because it can be really hard to communicate with them when you do have invisible symptoms and are quite young.
Mhm. How about you, Miranda?
Oh, yes, definitely. I have psoriatic arthritis, and our clinicians, please correct me if I'm wrong on my statistics, but I think about 15% of people with psoriatic arthritis actually don't have psoriasis. And that describes my symptoms as well. And so when it onset, it was just very, I think, very difficult to diagnose. A lot of my, you know, markers were coming back as there's inflammation, but nothing clear, nothing specific. And so I went to multiple physicians who I think just assumed maybe that my just it wasn't that bad, right? Because I was able to get through and get there on my own, even though it was really difficult and painful. So I went through, I mean, I think about 3 or 4 years of really, really trying to get diagnosed and to get support and treatment. And it really just, it didn't get me anywhere. I think where I finally landed at a certain point was, well, we're pretty sure it's an autoimmune arthritis. We're not sure what it is. So you kind of just have to wait until it gets worse, and then we can hopefully diagnose you and get you treatment, which is, I mean, is pretty terrifying, and is very scary because at that point you really have no control, right, over what you have. Um, so I think that was a really difficult experience. I think it was a combination of maybe a perception that I was perhaps exaggerating, or it wasn't really as bad as I was describing, combined with how difficult it was to just initially diagnose it, that led to that experience for me.
So maybe building on that answer, are there particular communication strategies or tools that helped you feel seen and validated in that process?
Yeah, I mean, I'd like to share I think it's a wonderful short story here. I actually I had a doctor advocate for me. And it was actually my OB, who had known me for a long time and had delivered both of my children. And I was just in for a regular checkup with her, and she asked about the arthritis because she knew that it was going on and that I had not had success. And at the time, I was having another flare that was pretty out of control. And with me in the room, she got on the phone and called a rheumatologist in town that she thought really highly of. And she really advocated. She said, I've got a patient here. This has been going on for a really long time. She hasn't been able to get help. She needs to be seen right away. And I heard them even say, well, it's going to be a while. And she said, no, she needs to be seen right away. And I think she just knew me well enough and had known me long enough, um, that it was really serious and I needed support. And so I was able to get in with that physician she referred me to, and I was in the room with him for 5 minutes, and he said, "You have psoriatic arthritis." And I said, "Are you sure?" And he said, "Yes, and you're going to feel better. We can help." And I think I just cried all over him. But um and he's been wonderful this whole time. But that's really what it took. So I think it for me it took having a medical professional who knew me well enough and was willing to really advocate. Um, and then the other piece of this that I would speak to is, um, I think don't give up, right? Go find another doctor, right? Go find someone else. And that, Eileen, I imagine you can speak to this too, can be a really physically and mentally exhausting process to go to someone, get your hopes up, think, okay, this is the time, right? This person is going to have an answer. They're going to be able to help me, and then to be disappointed. So I had to take breaks in that process because there were times where I think my heart couldn't take another one of those, and I would need to pause for a while and then seek treatment again. But I would just say, don't give up. Keep advocating for yourself. And if you're with someone who's not hearing you, go to another doctor.
What would you add, Eileen, in your experience? What strategies or tools have helped you to feel heard and validated?
I have found the best tool that has helped me communicate with my physicians is participating in research and volunteering and soaking up all the information that you learn doing that, and also speaking with other patients who have been diagnosed maybe longer than you. They can explain things in more of a plain language sense, and you can sometimes pick up, what kind of trends patients are talking about, like switching to medication types, or how do you explain this to your family, or things like that. So just communicating with patients can really help you when you're new. And then also volunteering and participating in research and things like that is an excellent opportunity to learn more about your condition, and then take facts to your physician who might be kind of skeptical about what you're saying, because if they can't deny facts.
What do you wish healthcare providers knew or asked about these symptoms that we've been talking about?
Me?
Yeah,
Or
go for it.
okay.
Yeah, sure.
Well, I really wish they would actually bring up some of the invisible symptoms. It seems like they get kind of brushed off, and you have to go and ask them about it. Well, I'm talking about fatigue, the sleep issues, anxiety, depression, malaise, and cognitive dysfunction or brain fog. Those are many of the symptoms that I felt that I had to bring up. GI issues is another one. It seems like it's always so focused on pain and stiffness, but we know that rheumatic diseases are so much more than that.
Great. How about you, Miranda?
Yes, I would echo that. I think just having those brought up by physicians as they're exploring a potential diagnosis would be really helpful. And then I think because it's so difficult to know when they started, right? The whole frog pot boiling water. I think some sort of, I don't know, some sort of framing of a question that allows you as the person experiencing it to go, wait, when was the last time that I didn't feel tired all the time, right? So there's, in a way, an opportunity for you to notice it as well as a potential symptom and reflect on when it maybe started.
Great. Okay, we're gonna shift to the clinical perspective with doctors Jonsson and Corty, who are going to help us understand what's happening on the provider side. And so first question on our list here is what symptoms do you feel are most often missed in the clinical setting? And maybe we'll start with you, Dr. Jonsson.
I think that's a really difficult question because rheumatologic diseases can be so different that you kind of have to be open to everything for everyone you meet. Like this is especially true of lupus. Like I still haven't met two people with lupus who have the same disease. But even with rheumatoid arthritis, it can be a little bit all over the place. And so what I think is really helpful is when I meet a patient and they have kind of like a 3-minute rundown of like what's been going on with them, or they've made like a little list, so that we can make sure to get through the most important things in an organized way. Like this is especially helpful for new patients, but even for return patients, like if you feel like brain fog has been like really going on, like, I mean, especially if it's brain fog, like write it down on like a little list, use your My Notes app or something like that on your phone so you can make sure to bring up all these things at the appointment. It's hard as a physician to remember to ask about all the things that are particular for your given rheumatoid arthritis. And so we will focus on the things that we can like see and measure and stuff with the pain and so forth, because if that's coming back, then you're definitely flaring. But like these other things like that, like we need a little help from patients to remember. And so do feel free to write them down. Side effects from medications, symptoms that have started popping up and you have no idea if they fit or not, if it's like rashes or some new pain in your foot or something like that, feel free to bring up pretty much anything when you come and see me as your rheumatologist. That's sort of my approach. And then we can hash out like, is it due to your rheumatologic illness? Is it due to, something else? Do you have a toe fracture? Like, is it something completely unrelated? Is it, iron deficiency anemia that's causing you to be tired? Like we need to do the detective work, but like I unfortunately think that in today's medical world, there is not enough time built in for the physician to ask about all the symptoms. And so do bring in the list of things that are happening to you.
Great. That's great. Dr. Corty, what would you add?
Um, I think that's great. I think that makes a lot of points that resonate in my mind. I think there's a big distinction in rheumatology care between the first time I meet someone and then the time we come to a diagnosis, and then the time from a diagnosis to long-term taking care of someone's chronic disease. And so I think that case that I think Miranda mentioned, where she met someone in the first 5 minutes, they diagnosed her. That's obviously the dream. From a rheumatologist perspective, it feels really good if someone walks in the room and you know exactly how to help them almost immediately. I'm maybe I'm filling in gaps, making assumptions, but I suspect it sounds like that person had the right diagnosis and they did have a treatment that actually helped you. Which is amazing. But then I do think in that period, for many people, there's quite a delay between meeting them, getting to know them, getting to understand what's going on with them, and then coming to a diagnosis. It might be the first visit, it might be the second visit, it might be the 10th visit. Hopefully not 10, but I think kind of echoing what Dr. Jonsson was saying is, it's hard. It's kind of hard on everyone because I think the patient sometimes doesn't, they want to help us make a diagnosis. They want this problem to get figured out, but someone might experience 10 different symptoms and they don't know which of those symptoms is going to light a light bulb inside their physician's head and make the physician say, "Oh, now I know what it's going on." So it's kind of a balance between what's bothering you the most and also of what you're experiencing, which of it seems the most unusual. Fatigue is classically a very hard symptom to make sense of because so many things can cause fatigue. I think Dr. Jonsson mentioned iron deficiency anemia as another common cause. But if someone comes to me to my clinic and says, about once every couple of weeks, my ring finger on my left hand swells up like a hot dog, and all the other joints on my body are fine. That's very specific for psoriatic arthritis. So I think that makes everyone kind of, I don't know, that sets everyone up for success.
Great. Maybe you can each talk a little bit about what the connection is between inflammation and symptoms like fatigue or mood changes to kind of build on what you were saying. And Dr. Corty, maybe we can start with you since that builds on what you were just commenting on.
Saying the connection between inflammation and invisible symptoms.
Yeah, and the connection between inflammation and symptoms like fatigue or mood changes.
Yeah. I think there's a massive connection. Inflammation is something, it's a biochemical response in our bodies. It's good. It's how we fight off infection. It's how we surveil against cancer. Typically when we're talking about rheumatic disease, we're talking about inflammation that has gone on too strongly for too long. And it takes energy for our bodies to create inflammation. So, it makes perfect sense that inflammation would be fatiguing. I don't have research on my fingertips to delve any deeper into that connection, but it does seem like something that both I see a lot clinically and it, on face, it makes a lot of sense.
Great. Dr. Jonsson?
Yeah, I definitely agree. Like there are many known connections between inflammation and fatigue. I think the tricky part is that, so inflammation almost always causes fatigue. Fatigue is not at all always due to inflammation. And I think that is the part that is sort of tricky. And so I definitely agree with Dr. Corty that like when I first meet someone, fatigue is actually not helpful to me in making the diagnosis, like at all. Like not even a little bit. Whereas, like these other things are. And so fatigue is something that's much more useful to talk about at return visits. Like if you've been on a medication for a long time and you're now having fatigue that feels like the fatigue you had before when you were first diagnosed and like the pain is like not really changing, but like you're worried about the fatigue, mention it then, but like not at the beginning. And that's because, like if you're fatigued, it could be due to inflammation, due to new and not yet diagnosed rheumatoid arthritis or psoriatic arthritis or lupus or whatever it is, but it could also be due to a number of other things. And so, definitely mention fatigue to your primary care, your OB, or whoever you're seeing. They have a number of different tests that they each look at, to investigate fatigue, thyroid hormone tests and, iron levels and things like that we talked about. But the connection there is not a one-to-one. Inflammation causes fatigue, but so do many, many other things. And so we need to keep an open mind about all kinds of different things that can cause fatigue and not equate it to disease flare every time.
Great.
Can I add on one thing to that just came to mind?
Absolutely.
I think a lot of time, and obviously anyone can jump in if I'm, making assumptions or whatever, but I think sometimes the question in a rheumatologist's mind is actually, what can I offer that would help this person? And if someone has fatigue, and then the reason I'm saying this now is because Dr. Jonsson mentioned that many different things can cause fatigue. The things in a rheumatologist's armamentarium are generally anti-inflammatory medicines, TNF inhibitors, IL-6 inhibitors, other cytokine inhibitors. And if the fatigue is being caused by something other than inflammation, we bring out our tools and we actually just expose people to risk without any real benefit. And that's why we're trying to figure out where an invisible symptom is coming from. And I think sometimes there's a frustration on the part of a patient, maybe, of like, well, just try something. You have all these medicines in your pocket, and it's just hard to sleep with it's hard to feel good about what the efforts you're putting out during the daytime if you're putting people at risk for infections without any foreseeable benefit.
Great. Yeah, that's helpful. One more kind of question for the providers here. What strategies do you think can help manage some of these invisible symptoms? Fatigue is obviously a piece of it, but brain fog, depression, anxiety, a lot of the ones we've mentioned already. What strategies can help manage these symptoms from a clinical standpoint?
I think this actually ties in very nicely with what I was sort of feel like I'm not maybe explaining myself super clearly, but in medicine in general and maybe rheumatology especially, we're just obsessed with figuring out why something is happening. A symptom itself, that's really the difference between a symptom and a diagnosis. No symptom generally correlates directly to a recommended treatment. You kind of have to use all the symptoms that someone's experiencing to come to a diagnosis. And once you have a diagnosis, then you can start making ideas on treatment. I don't know. Does that kind of address the question?
So, yeah, what would you add, Dr. Jonsson?
So I think that there are a couple of things to do. So one, definitely document your symptoms, because I think that, like Miranda mentioned, like often these things like start so slowly that like you're not really sure what's going on until it's like terrible. But I think once you do have a diagnosis, and so let's sort of like center on that, because I think that the diagnosis of a rheumatologic disease has to be made by not hidden symptoms. But if you have hidden symptoms and you have a rheumatologic diagnosis and you're like wondering if, like, am I feeling more down? Like, am I feeling more tired? Start to make like little notes, like either in a paper calendar or in like, like on my notes app or, like whatever works easiest for you to sort of try to like quantify it or see, like I think that think about the time of year, so like everyone comes in and talks about fatigue in like January and February, me included. I mean, so I was in Boston for a long time. Now I'm in Colorado. We have winter time. February is a hard month. And so, usually then, unless it's like, we have like other symptoms, we tend to like kick it down the road and revisit in May. In May, like the outdoors is like helping you along, right? It's green, it's like sunny, it's that. And so if it's seasonal, that tends to make it better. But, like start documenting not just the fatigue and the mood changes, but are other things happening? Are you more stiff in the morning? Like Do you have like, blurry vision all of a sudden, or, like, are you getting mouth ulcers? Like, do you like normally walk 3 miles, but now you can only walk 1 mile? Like think about the other elements of your life that are different. That way, when you see your physician next, or, if you make a special appointment to talk to them, you can say like, this is my laundry list, right? I do not mind it when people come in with like 15 things that they're talking about. Maybe only 5 belong to the rheumatologic disease, but that's my job to know, not your job. And so, bring in the 15 things. Like I will type them down in a little bullet point list in the note, and then we'll like work through what makes sense and not. The other thing is, like, especially if you're fatigued or have mood changes, if you're anything like me, those things go together. And I have to think hard about whether I'm sad because I'm tired or whether I'm tired because I'm sad. And that usually takes me a few days to like think about. Depression is a big, big cause of fatigue. And so think about, what is the fatigue meaning to you? Is it fatigue? I don't want to get out of bed. Is it fatigue? I don't want to get together with my friends. Is it fatigue? Like I can't walk around the block. Is it fatigue? I fall asleep if I sit down on the couch at 2 o'clock in the afternoon. Like making sort of concrete details about like what that fatigue is for you, is helpful to both to you, to just sort of like characterize it, and also when you bring it to your primary care doctor, your rheumatologist, or whoever you're talking to say like, when I say fatigue, I mean, and here are concrete examples of what I'm experiencing.
That's an outstanding answer. That needs to be recorded. I think that would help. I kind of wish everyone who comes to see me would hear that, because then we could, make as much progress as possible. Absolutely.
Yeah, because I think all of those things make a difference. And so I think the other thing is, like do the things that we should all be doing, which is going to bed at a reasonable hour, getting a reasonable number of hours of sleep per night, like not having coffee after X time in the afternoon, so sort of if you want to get the most mileage out of your rheumatologist visit, think about what you're doing and try to correct those things as much as possible before you see them. So you can say like, I am feeling fatigued. I sleep 8 hours per night. I only have coffee in the morning, and I still, have like these and these and these issues. And that way you prevent the rheumatologist from being like, well, you should try to go to bed sooner, and, like all that kind of stuff. And so, there's low hanging fruit that you can address even before then. The other thing I would say is like, there are a lot of other things that cause fatigue. Junk food is probably like one of the things that I think people do too much of that is not good. And so like take a look at what you're eating, when you're eating, how much you're eating, etc. If you're having trouble sleeping, like if that's something that's happening to you, like bring that up. Does it take you 3 hours to fall asleep, et cetera, et cetera? Because that's something that your primary care doctor or your rheumatologist or whatever can like give you like lists of suggestions for what's called sleep hygiene that can help you fall asleep easier. And so, think about each element of your day, your morning, your midday, your afternoon, your evening, your nighttime. Like, are you doing all the things that, a perfect human being would be to the best of your ability? And, like as well as a human being can, and still feeling fatigued, because that means something. But I think the tricky part is in 2025, like being an adult, like being a mom, being a single mom, like a working person, all these different things, like it's very stressful. And I think that's what makes fatigue hard to deal with from both a patient perspective and a provider perspective.
Absolutely. That's great. Yeah, such important insights all around from all of you. I'm going to do a quick reminder. So if our participants have questions, be sure and add them to the Q&A. We have just a couple more minutes of the panel, and then we'll move to that. But in this last little section, I want to talk about how we can close the gap in understanding. So we've talked actually quite a bit about tools and some of the tracking and the way and the things that you've already mentioned. So I'll try to sort of come at this from a place of adding information to our discussion here. We really want to move, obviously, on both providers and patients side towards a more meaningful two-way communication so that you can find these solutions and find the answers. So I'll start with Miranda and with Eileen. what advice would you give to someone who may be struggling to describe the severity of their symptoms to a provider?
Mm.
This is a great question because I had thought about this ahead of time, and my answer was essentially what Dr. Jonsson just said, which is making sure that you're coming in with a list of all the things you've already tried, right? So that you can demonstrate, like, I've done some of my own sleuthing to try to rule out what could be the culprit here. So I think that's really important. But the other one was the other thing that you recommended, which is try to frame them in the context of an objective daily task. Even like the pain chart, right, with the smiley faces and the frowny face, it drives me bonkers because that's still so it's so varied by person. But I think if you can frame it in terms of I am so fatigued that I can't stay awake more than this many hours, or I am so fatigued that I really can't complete basic daily tasks like making meals, right? That's really different than I think I'm really tired, which just it's so nebulous. And even with like the arthritis symptoms, I do appreciate, right, that there are these questionnaires every time I go in for a checkup that really do this, rate how difficult it is for you to button, right, to do buttons, or to bend down, right, or to walk this far, right? So I think all of those objective measures are really helpful in communicating really clearly what's going on and kind of how severe it is, and then what else you've already eliminated as a potential culprit.
Great. How about you, Eileen?
Well, I completely agree with the describing your symptoms and how they impact your daily life and your quality of life. That's super important. But the other thing I would recommend doing is tracking your symptoms. What really helped me was tracking my symptoms with a wearable device, especially my sleep issues, because it would show me how many times I was waking up in the middle of the night. So that taught me that I had sleep issues. I had fragmented sleep, and I could start to see patterns and how my symptoms were affecting me. Like, for instance, as a woman, my hormones dramatically affect my symptoms. When an increase in pain, increase in fatigue, increase in a lot of things. So I started to notice that when I started tracking my symptoms, which was beneficial to bring up to my rheumatologist for just advice she had. And then just also being able to see if your medication's starting to work better for you, to see, like, for example, I like to track my steps, and I say a good day is when I can get to 5,000 steps without foot pain. And a really good day is 10,000 steps. I feel really good about myself. But if I can't make it to that 5,000 steps without experiencing more pain, I'm going to bring this up to my rheumatologist, especially if it lasts for more than 3 weeks. Because that could be a sign that my medications are starting to wear off. Number of things might need to be going on. I could have an infection. So things like that. I find wearable devices, doesn't matter really what brand, they're just super handy. And also great for reminding you to take your medication.
That's great. Thanks for those insights. So for our providers, what kind of language helps you to better understand how a symptom affects a patient's quality of life? We've talked a little bit about this, but is there anything you would suggest patients think about in terms of the language they're using with their provider? Sorry, Dr. Jonsson, start with you.
Yeah, I think that the objective examples are helpful, so like I can't get through the afternoon without taking a nap versus, like I sit in a chair to make dinner because like my legs are too tired to help me stand. Like I think that or like I'm really tired and like I am awake every night from 2 to 4 a.m. Like giving like going beyond the I feel tired to give exact examples of like what could be related to that so that we can like think about that helps us with causes and it also helps us with solutions. So if it's like I'm really fatigued, I tried to go for a hike, but I had to stop, like every 30 feet on the uphill because I was getting so winded, like that's very different from like I fall asleep at 2 p.m., and that like so those kinds of specific examples as opposed to vague terms. It's also the same like the other term that people use that's not helpful is like I have inflammation. like I think it's like the more specific you can be as opposed to using these vague terms is going to be helpful. Like I have swelling and pain here, like I have swelling and pain there, I have a lot of morning stiffness in like this joint or that joint. Like specificity is always going to be helpful in terms of determining what's going on.
Great. Okay, we're gonna skip to I know everyone sees there's a panelist. There's a couple more questions on our list, but we have had such a great conversation, and I think we've covered a lot of what we set out in terms of our objective for the panel discussion. So I want to move to the Q&A, and we'll go from there. So I'm reading and talking at the same time. That's always tricky. Okay, so our first question, how do you get all of your doctors on the same page when you have multiple autoimmune diagnoses? I think we'll probably bounce this. Maybe Dr. Corty, you could start us off there.
Sure. I will just validate. I'll say that can be hard. The the thing that I've seen work in my practice is if you can go to a multi-specialty clinic of some kind where the doctors are more likely to know each other, more likely to go to the same break room, or at a minimum have access to the same electronic medical record system. Um, just I work at a university hospital, and so I take care of patients who have um, lung disease associated with their rheumatic disease, and some of them have a community lung doctor, and some of them have a university lung doctor. And even if those two lung doctors are equally as good at their job, it's easier to collaborate with the one who works in the same building as me.
That's great. Maybe from Miranda or Eileen, any advice from your perspective?
I bring notes. I've created my own little questionnaire sheet that I take to doctors, and I bring everything with me when I go to the different appointments. Because sometimes, well, where I live, there is an extreme doctor shortage, so sometimes we can't really pick and choose who we have. So it's just really important for you to bring notes. If you need to ask your provider to write something important down, that's okay. And I think that's one way when you can't guarantee that the two physicians are going to be able to communicate together.
Great. Let's go another question here.
Can I just mention one other thing? Sorry, just came to my
Yeah, of
mind.
course. Yeah.
Some patients who have like a community pulmonologist, for example, they'll actually print out the progress note that their community doctor wrote about the last visit, and then they'll bring it when they come, which is awesome. Because then, you're seeing the exact words the doctor used when they documented the visit. And no criticism to the patient, but they might not remember or understand every single detail the doctor wrote down.
Great. Okay, so next question, Miranda, I'm going to let you take this one because you spoke a little bit about it in your remarks earlier. How do you as a patient reconcile the exhaustion associated with your diagnosis and being your own healthcare advocate?
Oh, with difficulty would be the short answer. I think giving myself permission to take breaks, right? Sometimes I think just to say I need to take a break from seeking care and advocating, and just rest from that for a moment and then kind of re-engage with it. I think that's okay. And then I also think having support system, right? An advocate who knows what's going on with you. And so, I mean, not everyone has this, but if you're fortunate enough to have someone in your life that you can kind of say, I need a break from managing this right now. Can I hand this to you? Will you do this one task? Or will you, in 3 days or a week, like prompt a conversation with me where we talk about next steps again? And that person, that can even be like, I don't want to talk about this for a week. So I'm asking you right now, we're going to take a break from this and then re-engage with it later. That's been my best tool and strategy.
Right. Giving yourself grace and having a support system can go a long way in a lot of aspects. Dr. Jonsson, next question here for you. If you have a common co-diagnosis for arthritis, I and wonder if you may have one of these diseases. What test should you ask for? Sorry, I bungled that question. I think hopefully it was clear.
Yeah, no, so I think that is a very tricky question. It's very tempting to resort to Dr. Google and go down some rabbit holes and so forth. And so I would say like I would not recommend trying to figure out what tests you need. I think spend that time making the list of symptoms, take photos of rashes, take photos of swollen joints, like and then put them in an album on your phone. Not in your photo feed. You don't want to have to like flip through 8,000 pictures of your like nieces or great like grandchildren or whoever. Make an album called, medical or rashes or whatever it is, and stick all the photos in there. And that is super helpful because they are time stamped
Yeah.
and they are visual documentation about what is going on. And so I, in a number of times, have made diagnoses of like psoriatic arthritis and rheumatoid arthritis and stuff, not with what I see in the exam room, but the photos of the swelling that has happened on like the other days. Because like often on the day that you go to the doctor, everything is like amazing. It's been like terrible for months, and then you feel like fantastic on that day. And so focus on documenting and let the doctor figure out what tests to do. And if you don't feel like you're being heard, go see someone else, either your primary care or seek a second opinion from a different person with a specialty you think you might need.
That's great advice. Dr. Jonsson, I'm going to stick with you for a second because you mentioned this, and then I'll open it up to the other panelists here. What role does diet play in some of these hidden symptoms?
I think it plays a pretty big role. We don't have like the evidence yet to say like do this, not that, but eating a healthy diet helps. Eating a healthy diet will help with inflammatory symptoms, and it will also help with fatigue from a whole bunch of like other kinds of things. And so if you eat a ton of processed food, like if you eat only fast food, like burgers and French fries, like all day, every day, like those things will make you tired because you are not getting like the full array of like vitamins and minerals and, food pyramid goodness that you're supposed to. And so I think that, we know for many rheumatologic diseases that eating a healthy diet, and by that I mean like a Mediterranean type of diet, right? Like lots of fruits and vegetables, minimize red meat, minimize fried foods, like that kind of thing. That can help with inflammation. It can help with rheumatoid arthritis symptoms, with other kinds of inflammatory arthritis, other kinds of autoimmune diseases. And so that is where I would start. A lot of people ask, like, oh, should I avoid nightshade vegetables, which includes like bell peppers and tomatoes and all that stuff. Like if you avoid all nightshade vegetables, like you're left with like carrots. And I think it's going to be like really hard to get, like, keep up your veggie intake if all the nightshade vegetables are rolled out. I don't think anyone's proven that like nightshade vegetables are bad for inflammation. And so, like ignore that advice. Don't be like Tom Brady. I don't know if anyone on the call is like from Boston. He had this like TB12 diet where he ate like very crazy limited foods. That is also not necessary. Just a plain old healthy diet is good enough.
Great. Miranda or Eileen, do either of you want to speak to how if diet has affected kind of your journey as a patient?
Yeah, I love speaking about diet. So I tend to follow, I don't like the word diet, first of all. I like the word nutrition. Diet to me sounds like a fad diet that I'm doing to lose weight fast. Nutrition is something that you apply to your lifestyle. And I tend to follow a Mediterranean food map. I say food map and not diet because I'm not following it all the time. It's impossible to follow it all the time. So just incorporating foods in the Mediterranean style diet that I enjoy, not ones that are on there and I don't enjoy, but they're healthy. I'm not going to bother with those. And I do notice a massive difference, especially when I focus on a plant-based diet, a reduction in salt and minimizing carbs. And I don't say quitting carbs because carbs are good for you. They're going to give you energy, which we need. And then focusing on just nourishing myself throughout the day, snacking on nuts, seeds, grains, that kind of thing. Lots of fruits and veggies, but also hydration is a huge one. When I don't drink enough water, of course, I'm going to feel really bad. And the thing about tomatoes is only if you have an issue with some of the ingredients in tomatoes, which people do, will they get some stomach issues. But it is correct. It's not causing you inflammation.
Great. We're going to wrap it up with one question, and Dr. Corty, I'm gonna send this one to you. So, the question is: doctors often ask me to rate my pain or fatigue on a scale, but that never seems to capture what it's really like. Is there a better way for me to explain how it affects my life day to day? Kind of building on several of the things we've talked about so far today.
Yeah, I mean, I think part of the scale thing, it kind of gets back to like, it's like doctors are people too, and they're, going to work and they're showing up to a job and they have some sort of, metrics that they're following. I think it's just trying to be something that's going to be consistent across people, across patients, and for any given patient across time. So I think even if the numbers are a little bit reductive, everyone kind of understands like a 10 is like I'm in so much pain that I can't live my life, and a 0 is like I'm feeling perfect, and kind of putting things somewhere in the middle. So I think it's kind of a silly exercise because of course pain isn't just like this linear scale. It's like something that affects your life, and there's all different sorts of pain and all different ways it can affect your life. But I guess I would just try to play along a little bit because they're trying to use it for your benefit. And if you, mutually recognize the silliness with them and just give a number that as close to make sense as possible.
Yeah, I think I'd like to add
Probably,
to that is
yeah,
that
yeah.
I hope your physician does not just ask you, on a scale of 0 to 10, how is your pain today? And if you say 0, they're like, that's great. We're going to continue your meds and then like show you the door. Like they're probably asking you this like 0 to 10 scale because they're trying to document in the chart, things that they can track over time. And so that number is not supposed to be the be all and end all of like the conversation that day about how you're feeling that day and also how you've been feeling since the last appointment. So I don't think that your physician should be putting that much emphasis on that numerical like scale. And so I wouldn't put too much emphasis on it as the patient either, just sort of like give them a number and then like launch into
Let
that
the
line
conversation
we talked
flow.
about.
Yeah,
Perfect.
that's a very, I completely support that. Great point.
Great. Awesome. Well, thank you so much to our panelists today for your expertise and your insights. Such an important conversation. And thanks again to our sponsor, Jonsson & Jonsson Innovative Medicine, who supported our conversation today. You heard the word validate a few times, and we hope that today's discussion has helped validate some of these often overlooked symptoms and provided some new tools and ideas to support better communication and care. Couple of follow-up things here. As a follow-up to the conversation, you'll receive a downloadable patient-provider checklist designed to help guide more effective conversations during appointments. You can also find that and all of our resources on arthritis and autoimmune disease at curearthritis.org. Don't forget to follow us all month long. It's a big month in our world, so follow us all month long for all the content and webinars and updates coming your way. You can submit all the socials at Cure Arthritis. You'll find us there. And for daily content. So it's a big month. So next up for our webinar series is Lab to Life, Understanding the Treatment Journey, Monday, May 13th at noon Pacific. We'll explore how new therapy moves from discovery to your pharmacy. So be sure and sign up and join us then. And thanks again to all our panelists. Thanks for everybody who joined us.